Hello, Dr. Tony Mangabat, President of the World Academy of Cosmetic Surgery. We are in our 5th week of the COVID-19 crisis shutdown in my own practice. Frankly, we're all in this boat together, and we need to keep the boat from sinking. Our 16th President of the United States, his name is Abraham Lincoln, said, "Give me 6 hours to cut down a tree, and I'll spend the first 4 hours sharpening the axe." That's what we should be doing. Even though we can't see patients, we can't operate, we can't make any income, and oftentimes we have to furlough all of our employees, there are things that we can be doing. In the United States, you can apply for an SBA loan, and these are forgivable loans. So if you don't have your application in the United States, get it in now, because it was intended to help you. So what do we have to do to survive this? Well, the most important thing that we do is be prepared to come out of it, because it's going to be a different game plan. We have to protect our patients, we have to protect ourselves, and we need a protocol. So develop the protocol now. The most important thing is to maintain your connection with your client base, your patients. We are sending out weekly newsletters telling them what we're planning to do and how we're going to do it. We are offering advice. The other thing that we're doing is we're doing video consultations. That doesn't necessarily lead to immediate business, but it certainly keeps your connection so that when you get started, you can inform those patients, and then they can actually make plans and actually sign up for surgery if it meets their needs. Then the other important thing is to augment and improve your digital media. Now, I'll be honest with you, it took me a long time to get my digital media to the point where it's been effective. My current website is now producing about 5 to 10 good leads per day, which is, for me, huge, because this is not a waste of time. These patients have actually provided names, addresses, emails, phone numbers, and oftentimes a narrative for what they're really interested in, what kind of problems they would like to solve with us. Now that is quality leads, and it's really decreased the amount of work we've had to do. I'm going to encourage you as a member of the World Academy to take advantage of Anselo. They've offered our members a free analysis of your own digital media, your website. I mean, what kind of traffic are you having? Who are your competitors? What are the key words that you're competing with? And how can you get more patients? This is the key. If you're a member of the World Academy, it doesn't cost you anything. You'll get a free analysis, and if you think they can help you, well, for me, it has been the most cost-effective money that I've spent in my, recent career. One of the important things that we have to do in preparation for reopening are issues of safety. What we are doing is planning our patient flow, meaning we announce it to all of our patients that we're going to open on a given date whenever our governor allows us to, but we're going to tell them what to do, which is we're going to confirm with them digitally, either by phone or by text. And then we're going to ask them to wait in their automobiles out in the parking lot until we tell them to come in. When they come in, their forms will have already been filled out digitally, and we will have received them and printed them. And when they roll in the door, we confirm their ID, and then we immediately whisk them back to one of the exam rooms that we'll use for consultation as well. And that's where they will stay the entire time. Our entire staff will take the appropriate mask precautions, hand precautions, wash hands, sanitizer, everything. And so will our patients. We're going to limit the number of people that go into the consultation. They're allowed to the patient plus one other person, preferably the caretaker. In that room, they will have their intake, they will be seen by the physician, the consult will be done, and they will be presented with whatever financial quotes we can give them. Any final questions are answered in that room, and as soon as we're done, We actually have computers, terminals in that room, and we can actually schedule appointments in the exam rooms. In addition, you're going to need a plan for the operating room. Your operating room is going to be perhaps the most dangerous place to be infected because you're going to be dealing with the patient's airway in many regards. So for our operating rooms, we are going to beef up safety for our anesthesia providers. If they're going to manipulate the airway in any way, well, that's the greatest potential for being infected. So we're going to get the appropriate N95 masks, the proper airway manipulation equipment that they have. We have a fiber optic scope. Fiber optic intubation scope is what I'm talking about, so that we can minimize the potential for coughing and spreading the COVID-19 virus. So these are safety concerns that I think are really important to establish before you even think about opening your doors. You have a solid plan in place, write it down, then walk through the entire plan with your staff. So May 18th is our tentative open date from our governor, and if that date stays open, we're going to be ready for it. What we did after the big depression in 2009 is, we took that time off and retrained the entire staff, including me. It was really important to learn about telephone etiquette and managing the phones, basically managing inquiries. That's the key. That's the first start to connecting with your patients. Your website is one thing. It can be enticing. People want this service, but when they reach your office, you don't want somebody that picks up the phone and says, yeah, we do that. No, you want to engage your patients. If you take insurance, you need an educated insurance staff that can say, all right, these are the insurance options that you have, and find a solution for them. And my goal for all of our patients is, even if we can't find a solution in our own office, we'll try and identify a solution outside of our office. For instance, we've got a lot of patients that are, they're insurance-based, but they have an insurance company that really won't work with us for a bunch of different contractual reasons. Well, I've got many colleagues in the state of Washington that I'll refer them to. And in many cases, they'll actually refer me, their family and friends, that because we were kind. And that's our net that we throw that's really wide. We don't want to discharge or discard any clients that call us because they're looking for help and we want to help them. So if you take that as your goal, is whoever calls, help them in some way, shape, or form, then you're going to be a big winner. Now, suppose you are able to improve the number of inquiries that you get. And a shout out to really my partners in this entire process. One is Angelo. Like I say, for the past 4.5 years, they managed my website, and our website traffic has improved significantly. The second is Allergan Access, and their partner company, BSM Consulting. I've used their training modules now for well over a decade. The educational module that helped me the most, frankly, was telephone etiquette. And I got most of that through the Allergan Access website. And for me, it costs, $750 a year? That's nothing compared to the returns on investment that I got from it. What I found is that even the telephone etiquette and the telephone consultation techniques work in the consultation room. It's amazing. And it really is a uniform way of getting everyone in your staff and on your team on the same page. And frankly, the big winner is the patient. They get a uniform message that you're interested in helping them, and they get an integrated solution to their problems. So me, my young associate surgeon, and my young fellow will be taking this course along with all of our medical assistants, my 2 nurses, and my front and back office staff. Again, sharpen your axe before you start to chop down the tree.